We have to find real solutions, and this is Bending the Trend. Hello and welcome back to Bending the Trend, where we are collectively fighting rising healthcare costs. I'd like to introduce Shawn Gremminger, President and CEO of the National Alliance of Healthcare Purchaser Coalitions. Shawn, welcome to Bending the Trend.
So glad to be here. Thanks so much, Norm.
Yeah, absolutely. So we'll jump right into it. Shawn, you've seen hundreds, if not thousands, of different vendors enter the ecosystem over the last bunch of years. Who would you say are the best vendors that your clients and members have implemented that you would recommend to peers and other benefits leaders?
It's a great question, Norm. So I'd say, as I think about kind of the vendors and point solutions in in the ecosystem, as you said, there's literally too many to be named. I went to the health conference in Las Vegas this year, my second year in a row.
I saw you there briefly.
Yeah, it was just almost aghast at just how many people are there, and frankly how much money is flowing into this system. What employers and purchasers are looking for is real accountability. And a real focus on helping patients get to the highest quality, most effective, and lowest cost sites of care. And what we truly cannot afford is sort of just yet another point solution that makes promises that we can't meet. Some of the places where I've seen solutions that really seem to be moving in that direction are things that help patients to navigate to sort of high quality, low cost sites of care. That I've generally been a fan of are Surest, of course, which is offered by United Health Group, and Garner, which is sort of similar in Surest in some ways, but it doesn't rely on use of a particular network. In the case of Surest, you have to have United as your primary carrier. But in both cases, it's really putting the power back in the hands of patients.
Yep.
I've long been a skeptic of what people call sort of consumer-driven healthcare, right? The idea that we should just make people have skin in the game, and if they have sort of access to some transparency and they're paying out of their own pocket, they're going to go out and find the most effective places to get healthcare. I think all of the data over the last 25 years shows that just doesn't happen, right? Mm-hmm. Most people can't assess quality, which is kind of understandable, and don't have enough access to price to understand what it's going to really mean to them, and so they tend to just defer to their doctors, right? Which is pretty reasonable. Most people are smart and they defer to expertise. So if your doctor says, hey, I want you to go see this orthopedist, most of the time you just go see that orthopedist, yeah, whether or not that's actually a good idea or not.
Well, it might be the right clinical thing to do, but there might be a more efficient setting of care that doctor isn't either aware of, or they're incentivized to send you to somewhere else in their system in which they charge crazy high margin.
100% right. There's, at least in the hospital side, there's zero correlation between price and quality. There can be places that are really high quality, but they also happen to be really high price. And that primary care doc or whoever is helping to sort of guide you, they probably don't even know what the relative price is to the patient or to the plan, in the case of a self-funded health plan, to the employer. They're just saying, I like this person, I think they're really good. Or as you point out, they may be incentivized or even effectively required to send people to somebody who's in network, whether or not that's actually the right move or not.
Yep, absolutely. And we've seen areas of a health plan get carved out and done well in the employer market, whether that's surgery, whether it's cancer treatment, whether it's radiology, infusion. There's a lot of things that are high margin in a health system that are starting to be carved out at the employer level. But let's talk about, Garner and Surest. You mentioned them by name. What did implementing each of those vendors do for some of the members of your coalitions? And do you have any data to share, high level, that can walk people through what's the benefit?
Yeah, so I'd say it's interesting. Both of them sort of promise significant savings to the health plan. And I will say the results that I've seen have been mixed, which isn't to say bad, just mixed. The patient experience from everything that I've been able to see is superior, right? People seem to really like the ability to have more power in their own hands, right? The ability to go on the app, see who's going to have the highest quality, lowest price, out-of-pocket cost to the employee, and those prices are tied to whether or not that is going to be a lower cost to the employer. So the incentives between the patient and the employer are aligned, which is fantastic. I have talked to employers who have said that they've implemented Surest and they've seen significant cost savings. I've talked to others who say not so much. I don't really know why. I haven't been able to sort of dig into the details as to why some seem to see savings and some don't. But I think, we should also be honest that, like, savings are critical to employers, but they're also only one half of the pie, right? In the end, what employers are looking for always is I think you and I have talked a little bit about this, Norm. Imagine you're a benefits leader in an employer. You have effectively two bosses. Sometimes they're literally, you have two bosses. But you've got the chief human resources officer who's saying, whatever you do, don't do anything that's going to anger our employees and their families, right? Don't do anything that is going to make it harder for us to attract and retain talent. And then on the other side, you've got the CFO who's saying, I don't understand. We're paying 12% more this year than we did last year. Like, do something, fix it. Yep. And employers are always having to sort of match those two things up. How can we get our trend down and continue to keep people happy? I think, it is okay for an employer to make the decision to say, I'm going to go with a Gartner or Surest, even if I'm not sure it's going to save me money. So long as it doesn't cost me money and it makes my people happier, fantastic. That's maybe still a smart move. I think Gartner is a little bit newer, and maybe it's sort of, it may not actually be newer, but I know fewer employers that have used Gartner, but I think what they like is the flexibility that it sort of sits on top of whoever their existing carrier is, and so you don't necessarily have to switch into one carrier or another, and it's independent, right? One of the critiques of Surest that I've seen is it's owned by United Health Group, right? And United comes with its sort of set of dynamics, and I've heard people kind of express concern that, like, well, are we sure that Surest is actually sending people to the lowest cost sites of care, or are they sending people, maybe putting a little bit of a thumb on the scale to sending people to providers that are owned by United? And I've asked the folks at United whether that's the case. They say it absolutely is not, but it's kind of hard to look under that hood.
Yeah, absolutely. And, what do you believe the biggest challenges are of benefits leaders today? Because you talk to them all day long. Mm-hmm. And what would you like a product or solution to come out with and solve that doesn't get solved yet?
I'd say, they have a lot of challenges. The two, sort of driving forces are what we've talked about, right? It's really about cost pressures. We've seen this, kind of across the country at the aggregate level. I talk to employers about it all the time at the micro level. They feel like their cost trend is out of control. The best solution out there is going to be something that meaningfully bends the curve and can be measured over time. The other challenge they have, and you hear about this all the time, I'm sure, on your pod, is point solution fatigue and this belief that I want to bring on, whether it's I need to bring on a MSK solution, I need to bring on a navigation solution, I need to bring on a whatever, is that those are just often poorly coordinated, and then it's up to the benefit leader who's understaffed to try to manage all of those things together. I think there is a real benefit to the solutions that sort of bolt on easily and that don't create additional confusion for patients and plan members, and don't add a huge amount of workload to the benefits leader who, frankly, is often not a health policy expert or, even a health benefits expert. Their focus is often on HR, right? And they spend most of their time sort of dealing with people who are standing at the pharmacy counter and they're angry because they thought that their drug was going to be a $10 copay and it was a $50 copay. They don't necessarily have time to do a lot of that research. I think that actually just brings me to another point that I think is critical, which is the role of the consultant broker in the ecosystem. And it's a real challenge that we at the National Alliance are trying to manage. Employers are heavily reliant on their consultants, right?
Yes.
They're understaffed themselves. They aren't necessarily experts. You want to hire somebody who you can trust, who's going to help guide you through a process. The challenge that we find is twofold. There are brokers and consultants that are excellent at their job, and there are some that are less good, right? And that's just true of anything. Yep. But I've talked to plenty of employers who are like, I didn't know about this solution. This seems like a really great idea. Nobody ever brought this to me. And it's like, well, that's kind of the role of your consultant. The second is that they are often deeply conflicted, right? If you're getting, kickbacks on the other side of the coin
from the carrier and the PBM, maybe a health plan carve out you might not recommend to your employer. Not that it won't drive down their costs, but it actually reduces your kickback from the carrier.
That's exactly right. So that's a real challenge, right? And I think one of the things we are trying to figure out is how can we help, consultants that are really doing the right thing and that are aligned with their clients? And then how can we create a movement among employers to say, I need my brokers and consultants to be much more transparent with what they do,
yep.
And I need them to be aligned with, the work that I'm doing. And that's a lot easier said than done. One of the things I found really fascinating and odd is that the quality and the sort of degree of deconfliction by brokers is not specific to a firm. So I've talked to folks all the time who'll say, I work with Aon or Mercer or Gallagher or Lockton or somebody like that, and I think they're fantastic, and I feel really good about them, and I know they're in line with me. And then other people will say, I work with a different person at all of those same firms, and I don't think that they're being honest with me. It's always struck me that there would be a real market opening for a consulting firm to say, here are our code of ethics. We are all going to operate in this way, and you can trust every single person who you talk to from our company. I haven't seen that, and I don't really understand why, but I'm hopeful that that's maybe a movement that we'll see over time.
I think solving the price cost issue starts with transparency, starts with understanding how everyone in the ecosystem is compensated: health systems, health plans, PBMs, pharma, brokers, consultants, employers even, and just clearing up some confusion so that we can actually have the real conversations that need to happen. So couldn't agree more. Really appreciate you joining us on Bending the Trend, and thank you for doing everything you're doing and your organization's doing to fight healthcare rising costs and really advocate for employers. It's amazing, and keep doing what you're doing.
Thanks so much, Norm. It's always a pleasure.
Thank you. Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.